So tell us what can cause erectile dysfunction. There's probably many causes of it, obviously. Let's go into the anatomy of it and what can cause it to begin with.
Well, yeah. So, I mean, there's kind of four main causes. Vascular dysfunction, like we just talked about, is the number one cause. That's about 40% or so. Then you can certainly have neurologic causes, whether that's diabetes attacking the nerves and the sugars in the bloodstream attacking the nerves, or whether that's a spinal cord injury or something of that nature, or even prostate cancer surgery, bladder cancer surgery, rectal surgery for rectal cancer, or colon cancer. These can all disrupt the nerve firing to the pelvis. And so that can certainly play a role from that standpoint. Beyond that, there's any number of other issues that can cause it, whether it's psychological. I mean, certainly sometimes if you remember, in order to get an erection, it's a parasympathetic response, which means that the vasodilation occurs to allow the blood to flow in and essentially kind of fill up that chamber and give you the rigidity or the stiffness. And so, for instance, from a psychological standpoint, say you're at odds with your partner and you've been having stressors and, whether it's financial problems or whatever other problems you have, if you just aren't getting along well and there's a lot of stress there, remember that stress response is typically kind of a sympathetic response and a clenching of the system and basically kind of vasoconstriction. And so that can kind of counteract the ability to get and or maintain a good erection. So, those are kind of the main kind of generalized categories that are out there. You certainly can have, other issues that go on that can cause it as well, though.
So that's great. Thank you for that explanation. I really appreciate it. So what about treatment? So, treatment obviously is going to be from more of an anatomy standpoint. If there's some psychology or sociology things psychology things involved, I don't think a urologist can really help with that necessarily. I mean, I suppose you do a lot of counseling on that, I'm sure.
Yeah. I mean, I think, certainly it's something where, that's where we work with other specialists or, the sexual therapists or what have you, and refer folks to them and get them on board with that from that standpoint. But certainly, in the meantime, there's always, there's pelvic floor physical therapy, which can help kind of strengthen some of the muscles in the pelvis and kind of reinforce the vascular system. There's, obviously the oral pills, Viagra, Cialis, Levitra, whatever, you name it. There's a number of them out there that probably you all have heard of. Beyond that, there's things like the little handy vacuum erection device that basically kind of engulfs the penis, and you kind of slide it on and essentially kind of pump it up. It pulls blood into the penis through a vacuum, essentially created in the tube, and that it causes engorgement. And that's kind of like an artificial way to kind of recreate what normal physiology does. Typically, that's used in combination with a little ring that goes at the base of the penis to kind of do what normally happens. Remember, so basically as the blood flows in and fills up these chambers, what happens is that the little veins that are in the penis actually are squished closed. And so that way, basically that blood can be trapped there. Normal physiologic response then is basically after orgasm, after ejaculation, the system kind of clamps back down, the sympathetic system kicks back in, and those veins are allowed to drain again. And that's how we get detumescence, or essentially kind of return to flaccidity. And so from that standpoint, there's those. Obviously, there are little injections that can be done to the penis. Basically, you take a tiny, tiny little insulin needle and just poke right through the skin into this corpora cavernosa chamber. And basically that delivers all the medications, all the signals needed for an erection that basically bypasses the spinal cord, bypasses the brain. They mostly can overcome a lot of vascular issues, although not the most severe. And then beyond that, there are a lot of experimental stuff. Anything that's good for your heart, your brain, from a vascular standpoint, is also good for below the belt. So I would certainly say making sure you're getting plenty of rest. Sleep is so important. Making sure your hormones are normal and optimized and balanced. Again, just talking about sleep a little bit more. Basically, most folks are probably best served sleeping in about 68 degrees, and to help them get into deep sleep the most often, or especially that REM sleep. But also, we talked about, in previous conversations, if you, even just for 1 week, if you miss out on that 7 to 8 hour window of sleep and you're only getting about 4 to 5 hours for the week, your hormone levels actually drop to about 10 years your age. So, or 10 years older than your age. And so, from that standpoint, certainly making sure that's in check. Obviously, anything that's good for that. There are a slew of different supplements or what have you that can increase nitric oxide and or essentially are good for your vascular system, whether that's L-arginine or pentoxifylline. These are all different supplements and medications that are out there that can be helpful from that standpoint. Also, I think there's a couple of different things that are still considered experimental from the sexual medicine societies. Those would be essentially stem cells, platelet-rich plasma or PRP, and then also what's called low-intensity shockwave lithotripsy or essentially shockwave therapy for erectile dysfunction, which basically is kind of taken from previous cardiac research in the initial phases where they delivered low-intensity ultrasound waves. It's not like you're actually getting electrical shocks or anything like that, but it's basically ultrasound waves that cause disruption and expansion and contraction of the cells, again, at a cellular level, to essentially cause, kind of some minor damages to where it essentially kind of causes the body or stimulates the body to regenerate. It's no different than if, say, you had a little mole on your forehead and you took a little razor to it, 4 or 5 times a day and kind of scrape the surface. Over time, likely what you would see is that your body's normal processes would essentially kind of regenerate and take care of that as you do that. And essentially kind of exfoliation, right? So from that standpoint, the shockwave can be thought about similarly, where basically it's kind of delivering low intensity ultrasonic shockwaves to the penis in this case, and those big corporal arteries that we talked about. This whole pink stuff on the top is the entire corporal cavernosal chamber on each side. There's 2 of them that run the length of the penis, and basically they're big, smooth muscle, blood-filled tissues, right? And so you get some little shocks in there or the little ultrasound waves in there causing enough disruption to where it actually helps repair the the angiogenesis or the vascular system, the arteries and the veins in the penis. And so that's one that's out there that certainly can be helpful. Important to note that with that one, ultimately you're going to want to make sure that you're using focused acoustic wave ultrasound and not radial wave ultrasound. There's a lot of different options out there. There's a Storz device that's probably the only one that's delivering focused acoustic wave ultrasound in the country right now that's FDA approved. And so from that standpoint, you certainly, if you're going to look into that type of therapy, you want to make sure you know what you're getting as far as what you're paying for. So focused acoustic wave ultrasound, shockwave lithotripsy for the penis is important, not radial wave. And then finally, again, to some extent, no matter what we do, in the most severe cases, we can never fix everything, unfortunately. But there's always the solution of the penile implant, which is basically an outpatient surgery. Usually takes roughly 30 to 45 minutes. And basically what it is it's a little 3-piece device that you see here, where you have essentially 2 little cylinders that go inside the penis, inside the blood-filled chambers where they normally would. It's basically a fluid hydraulic system. You got a little bulb, kind of like the old Reebok shoe. That's your pump. And then you have a little fluid-filled reservoir that's basically just it's filled with injectable saline. And basically what you do is you pump, and then these cylinders fill with blood, just like your corpora cavernosa would normally, and basically become rigid that way. And then ultimately you have stiffness or rigidity for sexual intercourse or what have you, any activities that you may participate in. So that's kind of the gamut. I know that's a lot of.
Yeah, it is. That was good. So let's, I love it, Dr. Wallen, because I know you're an expert on this subject, and I love it when I have guests like yourself because it makes my job a lot easier. I don't really have to ask a lot of questions. You just go on. So I love it. Thank you. It was great.